This tablet is a combination of vitamins and minerals that are essential for the body. It is used to address any vitamin deficiencies that may occur due to a lack of proper nutrition, certain medical conditions, or during pregnancy. Vitamins and minerals are crucial for overall health and well-being. It is important to take this tablet as directed by your doctor to ensure that you are meeting your body's nutritional needs. The recommended daily dosage and the best time to take this tablet may vary depending on individual needs, so it's important to consult with your healthcare provider for personalized guidance. When taking MVMin#10 Fa-D3-Alip Acid-Lut tablet, it is important to follow the instructions provided by your doctor or on the product package. Typically, this medication is taken by mouth once a day. It is important not to exceed the recommended dosage. If you have any questions or concerns, be sure to consult with your doctor or pharmacist. In order to get the most benefit from this medication, it is important to take it regularly. To help you remember, try to take it at the same time each day. This will help ensure that you are getting the most out of the medication. If you experience constipation, diarrhea, or upset stomach while taking MVMin#10 Fa-D3-Alip Acid-Lut tablet, know that these effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist right away. While serious side effects are rare, it's crucial to seek medical help immediately if you experience any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that not everyone will experience these side effects, and many people using this medication do not have any serious side effects. If you notice any other effects not mentioned here, it's best to consult your doctor or pharmacist for further guidance. As for the daily dosage and timing, it's best to follow your doctor's instructions. They have prescribed this medication because they have determined that the benefits outweigh the potential risks. If you have any concerns or questions about the optimal timing or dosage, don't hesitate to discuss them with your healthcare provider. It's important to keep this multivitamin out of reach of children, especially if it contains iron. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If overdose does occur, it's important to seek medical help right away or call a poison control center. Remember to always store medications in a safe place to prevent accidental ingestion by children. Before taking MVMin#10 Fa-D3-Alip Acid-Lut tablet, it's important to talk to your doctor or pharmacist about any allergies you may have to its ingredients or to soy/peanut found in some brands. This product may contain inactive ingredients that could cause allergic reactions or other problems, so it's best to discuss this with your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have a history of alcohol use/abuse, liver problems, or stomach/intestinal problems such as ulcers or colitis. If your multivitamin brand also contains folic acid, be sure to let your doctor or pharmacist know if you have a vitamin B12 deficiency, pernicious anemia, before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, and untreated vitamin B12 deficiency may result in serious nerve problems such as peripheral neuropathy. It's best to consult your doctor or pharmacist for more details on this. Additionally, before undergoing any surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to let your doctor know before using this medication, as well as if you are breastfeeding, as this medication can pass into breast milk. It's best to consult your doctor before breastfeeding while using this medication. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Also, do not start, stop, or change the dosage of any medicines without your doctor's approval. If your multivitamin contains iron, you should avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. It's best to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. It's important to note that this medication may interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. If someone takes too much of this medication and has severe symptoms like passing out or difficulty breathing, they should call 911. Otherwise, they should contact a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222, and Canada residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Always be careful with the dosage and seek immediate help if necessary. Be sure to keep all of your medical and lab appointments. Some brands of this medication may also contain ingredients like docusate. If you have any questions about the ingredients in your specific brand, make sure to ask your doctor or pharmacist. It's important to remember that this product is not a substitute for a proper diet. It's always best to get your vitamins from healthy foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines that your doctor has given you. If you are taking this medication on a set schedule and happen to miss a dose, simply take it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed dose and take your next one at the usual time. Avoid taking a double dose to make up for the missed one. Remember, consistency is key for this medication to be effective. It's important to take it at the same time every day. It's important to store MV-Min #10 Fa-D3-Alip Acid-Lut tablet at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.